Today, Doug Rawson here, the Executive Director from Helping Hands in Orillia. I want to share a little bit about Helping Hands, who we are and what do we do. We're a 50-year-old organization. We just celebrated our 50th anniversary as a not-for-profit charity located in Orillia. We provide services to seniors, really focused on keeping seniors independent at home. And that's focused around our Meals on Wheels program, hot meal delivery to clients' homes Mondays, Wednesdays, and Fridays in partnership with Soldiers Memorial Hospital here in Orillia, as well as a frozen meal program that's available to clients in the Orillia and Couchiching area. We provide accessible transportation with 10 vehicles on the road literally every day, helping to bring seniors to their medical appointments, social visits, hospital appointments, and doctor's appointments, not just in the Orillia and Couchiching area, but all the way down to Toronto. We'll bring it down to a specialist or doctor's appointment. We provide home and community care support, which could comprise of a homemaker or a personal support worker. Again, really keeping people safe and healthy in their home with the supports that they may need. We have a signature program, which we're quite proud of, called the High Risk Seniors Program, and that's providing service with our personal support and our homemakers up to 4 visits per day. And those are more high acuity level clients, but it's really about keeping them safe at home without relying on hospital or long-term care where they can be cared and supported by our service along with our supports with their family. As well, we have a transitional bed program. And our transitional bed program is located in Brechin. We have another one here in Barrie. We're proud of this program because it's really about keeping people safe while they're in the transitions of care. Our bed program provides care for you with a support worker in our facility for up to 90 days. And again, this is to help you with a transition. So one example would be if someone went to the hospital for surgery and they were going to go home, but there was a flight of stairs. It wasn't safe for them to do the flight of stairs, and they're waiting to get some support, some accessible supports, a ramp or care providers. You can come to our transitional bed site and we care for you again for up to 90 days until you get those right supports in place. So at a high level, that's who Helping Hands is and what the services is we provide. So the services we provide really helps people, again, keeping independent at home. As we know, access to services with long-term care, hospital, and healthcare in general is growing, and the need and the demand for the service is growing. But access to services, specifically beds, is not as available as what people would like. We have a tremendous wait list for some of our services. It could be up to a couple years. There's always a growing demand for the services, but as a not-for-profit charity located in the local area, it's really about providing people those supports, keeping them safe at home without relying on the hospital system and long-term care, that those beds are really allocated to the right client at the right time. You know, COVID had a tremendous impact on healthcare and healthcare workers overall. From our lens, business was normal. We had to continue helping people. We had to continue doing the work that we did. It had a pretty profound effect on our staff, everything from PPE to how we access to how we do. Helping Hands continue providing services with appropriate safety precautions put in place. The biggest impact it had on us was access to staff and human resources. You know, the entire health industry, and I would argue almost every industry, has been affected from COVID. We have lost a lot of volunteers. A lot of our services were really dependent upon volunteers. We lost a lot of volunteers from that transition period from COVID, as well as we've lost some frontline staff. We continue to make our recruitment of staffing a priority, but the biggest impact has really been the effect on staff and then the recruitment of staff as we move forward. So we're always looking for volunteers to join our organization. That could be anything from helping to deliver a Meals on Wheels program to helping with accessible transportation to providing reminder calls and doing just wellness checks with clients. We have a number of opportunities for people. You could access our services by going to our website, Helping Hands, Orillia.ca, or you can give us a phone call or stop into our office here on West Street in Orillia, or call us at our office, 705-325-7861, and our team be happy to help with onboarding as a new volunteer. As a client, you can access the same lens. We have open door interviews on Tuesdays because we're always looking for more people to join the organization to help more clients have more impact in the community. So Helping Hands is a partner with the Couchiching Ontario Health Team. We work in partnership with all of our health system partners. 30 plus partners are working together about wrapping care around the client to make sure that they get what they need. So we're not only focused on just our Meals on Wheels or just transportation, but it's really about providing the services that clients need at their time of need, but removing the barriers and making it easy and accessible for the service that they need. And we do that in collaboration with our partners, which includes the health team, the hospital, your family doctor, everybody within the system, to really wrap the service around you to make it as easy and painless as we can, but with our key goal of keeping you independent at home.